Yo, what's up? It's Mr. No Excuses. Hey, do yourself a favor. Hit that subscribe button. Woo! I need to go brush my teeth. Wash my face. Today is January the 11th. Yeah. January the 11th, and well, I gotta go get my procedure done. Yo, it's your guy Ralph, back with another video. Today's video is a very special video. Alright, today is the day where I go in for a procedure. Yes, as you've seen in my last video, I have told you my scoliosis story continues. Alright, now I'm going in to get a spinal injection. My appointment is in like 30 minutes, so I need to be headed up there. So I'm gonna be walking y'all through it. Alright, so if you ever have to have surgery, God forbid, one thing you want to make sure is wear comfortable, light clothing. Alright, because I guarantee you put on the suit or some jeans and some other stuff, you're not going to want to feel like putting that stuff on. Alright? Put on some comfortable, light clothing. Alright? So, as you can see, I got my walker. I got my face mask, which I'm finna put it on. My clothes, I'm ready to go. So, we finna head out. Alright? I'll see y'all in the next scene. We're on the road, people. On the way there. So I can't say I'm excited and I can't say I'm nervous. I'm just gonna go with the flow. Alright, so just tune in to see what else we got planned. The videos that I was supposed to react to, they got blocked. So like I said, it ain't my fault, but y'all continue to send me videos. Hopefully y'all can hear me, but if y'all continue to send videos, I will react to them. Hopefully they don't get blocked, but that will happen with those videos. Alright, so we on our way up there. I'll see y'all in a bit. See. Alright, y'all, we are here at the clinic. It's about to go down.
First and last name?
Israel. Raphael Israel.
We go right here for the pain.
Yep, I think so. If you got a procedure, probably the pain clinic.
Yeah, that's what it said.
We're just right here at the pain clinic, sir. Have you been tested for COVID? Direct contact with anyone confirmed with COVID? Any fever, chills, any onset cough, sore throat, shortness of breath, most likely not explained by physical activity, loss of taste or smell?
What? Bro, what are you talking about, man?
Can you repeat that?
Don't make me.
In other words, no.
In other words, no to all the above, right?
Right. Alright. Well, I'm going right here
He's
now.
going right here. I'm gonna open the door for you.
How you doing?
I'm doing good.
Alrighty.
What's that last name?
Israel.
Israel. What's that date of birth?
8/30/94.
Awesome. I know I saw your name on here. There you are. Okay. And the 14 days. Have you been tested for COVID-19?
No.
Now, give me your file. Give me a second here.
Alright, y'all. So, can't talk too loud, but gotta fill out this form, and then I'll be going to the back shortly. So, it's really about to go there. Alright.
Very well. If we come back to do this again, then we can talk about doing sedation at that time.
I thought that's what we were doing, because they was asking me about that at first on the phone.
Who did you talk to on the phone?
Nurse. Start with a C. Can't remember.
Miss Carlton? Vicky Carlton?
I'm not sure, but it was.
Um,
They asked me about anesthesia. And I was
yeah,
like,
typically, I don't do this under sedation. I think most of my patients tolerate it well enough without it.
okay. So I'm fine.
I think you're going to be okay.
Damn. All right. I don't do good with needles. Okay. All right. Cool.
I think you'll be surprised. All right.
All right.
Okay.
Sound like a plan.
Dr. Nelson's over here. He's going to come over and grab your signature. We're going to do this interlaminar epidural for you at 045, where Dr. McCarthy wants us to target. Okay. Do you have a follow-up with Dr. McCarthy after this?
Say it one more time.
Do you have a follow-up with Dr. McCarthy after
I
this?
should.
Okay.
Yeah.
So we'll touch base with him, and you keep that appointment and see how this does for you, and that will help him direct your treatment moving forward. Okay?
All right. Cool.
All right. And we'll see you back there shortly.
All right.
We'll be back there in the room again. So this is the consent form, so that we can get this procedure done. We're going to be working at the L4-5 level. That's just in your lower back there. And then is it going to be one side, both sides? It's going to be both sides. That's what I kind of overheard you guys were talking about being both sides.
What's my back?
Yeah. Yeah. So you said that the pain was worse
Oh,
on
my
your back?
legs. Yeah.
Okay. Yeah, so we'll do both sides there. For the consent, there's risks to everything that we do in medicine, okay? Consent implies that we've talked about some of the risks, and really the risks are low for this. There's always a chance that things can happen. Anytime you stick a needle through the skin, there's a chance of infection. That chance is low because we use a sterile technique. There's a chance that there could be a little bit of bleeding, which would be minimal. There's a chance that this procedure may not work. Sometimes that happens, that we would need to repeat or adjust the procedure. Okay. And then once we get in there, we'll communicate with you. We'll have you let us know if you feel a shooting pain down your legs. But there's a chance that sometimes when we get that needle real close to where it needs to be, that they'll feel a little zings down their legs, maybe feel some weakness as well. But typically, people tolerate it just fine. Okay. So it shouldn't be overwhelming for you.
I just don't do needles.
Yeah.
Yeah, but we'll try.
Yeah, I mean, it's definitely normal to have some apprehension about needles. I hear you. I'd be nervous if you liked the needles. most people dislike, and that's okay. This procedure won't need any blood for transfusion, but all of our consents have this on here so that if someone was to have a severe reaction to medications or require a blood transfusion, that we need to know if we can give you that blood to save your life. Is that okay? All right, so I'll need you to initial here. There you go. There. You can give me your initials up here. Perfect. Okay. No, yeah, there's the top one there. And then on the back here, this is just what we talked about the procedure. And just to real quick before we have you sign, just to do a head to toe. Any kind of seizures?
Not recently.
Not recently. Do you take medication to control seizures?
No.
No. Okay. When was your last one?
Years ago.
Years ago. Okay. Any stroke?
No.
Okay. Any kind of heart disease, heart problems, valvular problems? Okay. Do you have high blood pressure, diabetes? Any lung problems? Asthma?
Asthma.
Okay. Do you use inhalers?
No.
No. Okay. Do you smoke?
No.
Okay. Any kind of liver issues or kidney issues? Liver?
Liver? No. Liver, no.
And kidneys?
Kidneys. I have an assist on one, but it hasn't grew or anything affect me in a way, so they just leave it alone.
Does it give you any problems?
Not that I know of.
Okay. Do you take any blood thinners? Okay. So that kind of runs through just a broad spectrum of things. But have you had anesthesia before? Have you been put to sleep for surgery? Was there any problems with that? Okay.
That's why I thought I was getting it.
Hmm?
That's why I thought I was getting it.
Yeah. Yeah. No, for this one, like Dr. Smith was saying, that we typically not right out the gate because it's usually people are able to tolerate it pretty well. But we'd like to just see here. Okay.
How long? I don't even want to know. I don't even want to know.
Nah, it's not too bad. It shouldn't be too bad. Do you have any questions about procedure, consent, or?
I asked earlier.
Was that?
I already asked
Okay.
about the anesthesia. So.
Yeah. Okay. So if you wouldn't mind then, if it's okay that we proceed, if you can give me the signature here and the date and the time. So signature here. And the date is the 11th, so 1/11/21.
Look, he's just as surprised as those kids were when the presents got open. He didn't know what was on the
Okay.
box. He did not know. He's like, oh, yeah.
12:49.
You're welcome. It's a surprise for everybody but me.
Let's see.
All right.
15 minutes later.
Yes. Lauren already told me. Okay, good. Okay. Well, I'm gonna let her know. Yeah, and I'll talk to you about it real quick and we'll sign a brief.
Well,
Okay, because that's for the children, right?
cannot feel my lips. Horrible.
Mr. No excuse. What?